Hi, welcome to another episode on Mednatory Dr. B. Now, today we're going to be looking at an amazing topic. Now, this is a very common chief complaint when it comes to respiratory system. Either you face it as a medical student, or a medical doctor, or any form of healthcare professional, or even as a patient. It's a common chief complaint you tend to have, not even in this season, which is the flu season. So that chief complaint is ta-da, cough. Now let's dive into it. Important questions you need to ask on history of present illness, because don't forget, we've already done history taking as a broad terminology, right? We've looked into identifying data, history of present illness and history of past illness, review of systems, and summary closure. So I would rather refer you back to the YouTube video on history taking. Now we'll be focused on just the history of presenting illness when it comes to the chief complaint, cough. So let's dive down into that. Hi, how are you doing today?
I have a cough.
Wow. Chief complaint, cough. When did it start?
It started like last week.
The onset of the cough. Does this cough come and go, or it's constant?
It comes and go.
That's frequency, where we check if it's form of intermittent or it's a continuous kind of cough. How will you describe the length of the cough? What's the duration like?
Once the cough starts, I start coughing for like up to a minute.
Duration. Have you noticed any form of difficulty breathing, shortness of breath?
No.
How far can you work before you notice some form of difficulty breathing or shortness of breath?
I can work for a long time, then I feel difficulty breathing and the cough starts.
Is there anything you've done to make it better? Anything you do that makes it better?
When I sit and rest my back on a chair, it gets better.
Alleviating factors. Is there anything you do that makes it worse?
When I like do strenuous activity, like walk for a long time or exercise.
Is there anything you notice that makes it worse?
Maybe if I'm in an environment where it's dusty or the environment becomes like maybe cold.
Do you wake up coughing?
No, but a few minutes after I wake up, I start coughing.
What do you do to get better at night?
I mostly drink warm water before I go to bed to relieve it, or I steam my face.
Okay. Does it affect your daily life?
Sometimes when I'm like maybe eating or doing something, the cough becomes so intense that I have to stop doing what I'm doing.
And have you used any form of medication so far?
I've tried using cough syrup.
Any other treatment?
No, just cough syrup.
Now, aside all this, we talked about, have you noticed any form of other symptoms at all?
Sometimes I feel my chest ache when I cough for a long period of time.
Okay. So you notice some form of chest pain?
Yeah.
Any other thing?
No, mostly chest pain.
Okay. Now that you asked me about associated symptoms. Now in this instance, you will notice I occasionally ask on specific associated symptoms in regards to respiratory system. So we talked about SOB, shortness of breath, talked about chest pain. As we go on, you'll see me ask the patient more questions, because most of the time your patient may not remember some specific associated symptoms, but you need to rule out this way in order to have a differential diagnosis at the end of the day. Okay. Have you noticed any form of fever?
Yes.
When did that start?
It started like 2 days after my cough.
For how long do you notice this fever?
I notice it's mostly for a while, like in the afternoon or towards the night when I'm about to go to bed.
Would you say that you notice some form of skin rash?
Yes.
What about chills and rigors?
Yes.
Now, when you cough, do you notice any form of sputum?
Yes.
Okay, now this is very important because you want to rule out if it's a dry cough or a productive cough. Now, whenever you hear anything productive from your body, don't forget the rule which you learned from the history taking episode, whereby you need to ask the ABCOs. A, amount, B, blood, C, color, and O, odor. So watch me as I ask this question. How will you quantify the amount of the sputum?
It's like little. I feel it's like in my mouth after coughing.
Do you know there's any form of blood?
No.
How will you describe the color?
Like yellowish.
Okay. How does it smell? Like does it have an odor?
No.
Okay. Now you talked about the chest ache. The chest pain, where exactly did you notice?
My left hand side.
Okay. Now when your patient say anything on pain, don't forget the rule. You need to ask specific questions on history taking specific to chest pain. So remember location, onset, radiation, duration, the aggravating factors, frequency. Don't forget the character of the pain. Don't also forget to ask about the scale, on a scale of 1 to 10, how we describe the pain, and definitely if the patient has used anything for the pain. Now, so does this pain move anywhere?
No. Yeah, I feel it's my back.
Okay. Have you noticed you being fatigued or tired?
Yes.
Now, just one more question. Please, have you had any exposure to TB, tuberculosis?
No, that I'm aware of.
Okay. Now, with all this, you are now done with the history of present illness when it comes to the chief complaint, cough. Do me a favor, go through our past episode on history taking to also review identifying data, history of past illness, review of systems, summary closure. See you later. Don't forget to subscribe, share, like. Bye. Hi, how are you doing?
I'm fine, thank you.
What brought you in today?
I have a cough.
You are fine, thank you, and you came to see your doctor.